Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be joined by Matt Seefeld. He's the Executive Vice President at Medevolve, practice management company that's really starting to use artificial intelligence to drive some automation. Matt, thanks for joining me today.
Nick, thank you for having me. I appreciate the time.
So first off, for our viewers' benefits, tell us a little bit about you, yourself, your background, how you arrived at this role, and a little bit about the company, if you could.
Yeah, absolutely, yeah. So I've spent my entire career, Nick, in healthcare. I started out on the consulting side and revenue cycle. Spent quite a few years working with large health systems, IDNs, large integrated physician networks across the country, really looking at people, process, and technology and how those align to try to maximize revenue cycle performance. Obviously, this day and age, that's important. I actually built a analytics workflow automation company. I left Deloitte & Touche in 2006, and I started that business, Interpoint, in 2007. I built that up over 5 years, and then we were acquired by a public company out of Atlanta, Streamline Health, in 2011. So some of the stuff we're going to talk about today, I have, I guess, been around that block before, but it's still very relevant. I think automation, using AI, allowing problems to come to the surface without us having to spend lots of people hours trying to find that information is very relevant in this day and age. And that's really what we've done here at Medevolve. Medevolve has been around for over 20 years, practice management company at its core. I always say, we get your claims out the door and get you paid. That's what we're good at. We also do have a services business. It is, yeah. I think people like to get paid for the stuff they do.
It seems
especially with the insurance companies try to take that money away from you. But, our services business is about half our revenue. We do billing and AR management for a lot of specialty physician groups across the country as well. And that actually is really the starting point as to why we had to build a lot of this workflow automation technology, because frankly, I had to reduce headcount. I mean, to cut to the chase, we were very overstaffed. Our margins were declining without us doing anything. Half that dollar comes from the consumer now. It's not the insurance anymore. And we get a lot of that carved out in our contracts. And the insurance companies are getting harder and harder to get reimbursed appropriately from. So my cash is under pressure without me doing anything, really.
Before you go on, just to sort of clarify for everybody's benefit, I want to be sure I understand this. I think this is the case. But when you say half the dollar in terms of payment, you're talking about all these high deductible plans. It's the fact that we're now paying out of our wallets that's shifting the pressure on this whole billing environment.
Yeah, it's exactly right. If you think about 20 years ago, that it wasn't an issue. So I think about 95% of the provider income came from a third party like insurance. It wasn't contingent on what we as a consumer's portion was. Nowadays, that has changed. I mean, me personally, our family deductible is over $5,000. So I haven't even hit that for the year. So, for me, I'm still writing 100% of the check. I've got another bill sitting on my desk right now from a children's hospital, and I'm not paying it right away. I will pay it because that's the kind of guy I am. But but a lot of people, unfortunately, they can't pay it, or they just don't have the ability to do it. And so the pressure is already there. And so again, if you look at cost to collect, you have to, as an organization, I'm telling you this right now, whether you're a billing company or you're a provider, you have to reduce your cost to collect. And in order to do that, you're going to have to be more efficient with your FTEs, your headcount, right? You also have a lot of minimum wages going up now. Benefits are getting more expensive. Insurance is more expensive. So your administrative costs of managing people goes up as well. So your reimbursements are going down. It's harder to collect from the consumer that owes you more money, and your administrative costs are going up. So I would focus on workflow automation and analytics and transparency to really make sure that you're minimizing that cost to collect.
So when you think about the company that you're in, they started out, well, I don't know that they started out. I think they started out as revenue cycle management and the whole billing process. And, I don't want to sort of trivialize it, but relatively easy work because it was coming from insurers. The fight wasn't quite so big. There's been all of this downward pressure. What was the sort of steps that got you to this point of we've got to fix this? And then the technology application that you've applied here that gives you these tools that you're essentially now offering. How did you reach that sort of pathway?
Yeah, well, a couple of things happened to us. So I've been with Medevolve since 2017. I came on board originally to run business development in January of 17 full time. And I saw right away that we were in a commodity space. EMR craze was coming to an end. Everybody has a billing system. And to be honest, revenue cycle services it's been tarnished a bit. There was a big push in the early 2000s to outsource. A lot of the stuff was done offshore, a lot of quality issues, and a lot of people got burnt. And so, being an insurance RCM company and a practice management company is really a tough market if you're trying to grow revenue, right? And so what we had to start looking at is, okay, what else could we do outside of those cores? And that's really where we started to think about what we could do in the cloud around workflow automation, bolt-ons, more solving problems along the revenue cycle, from really everything from scheduling and financial clearance all the way to AR management, and all the things in between. And so our two big focus points were analytics and transparency and workflow automation. Now, how we came to that was out of necessity. I took over the revenue cycle department in April of 2018. The board of directors had asked me to take that over because our margin had all but disappeared. And and we're a small business. We don't have private equity. We don't have deep pockets like some of these larger blue chips do. So for us, a lot of our R&D it comes out of the cash flow generated from the services side of the company. So for that margin to be gone was going to be detrimental to the business if we weren't careful. And in order for me to obviously start to crack margin, I was going to have to find ways to free up FTEs. And so that's what we've done, right? We were at about 86 FTEs back then. We're running under 40 now.
Wow.
We've had a lot of consolidation. We restructured a lot of the way that we do the billing and everything. We're all everything from charge entry and coding to AR management, denial management, and posting, payment posting. But the most important thing was making sure that the technology I call the work drivers that my team uses every day tells them exactly what they need to do. There's not a lot of thinking that goes involved anymore. If the claim is in front of you, that means that I want you to work it. That means there's a reason that claim is in front of you. Don't look at things that are not going to generate any benefit, right? And so part of the AI is carving the nonsense out to the job tasks that these folks are up against. And that's been accretive in value for us because our folks are highly efficient and they're able to really focus on things that are going to drive, in our case, drive reimbursement, because reimbursement means I can bill for it. The one other piece I'll point out, Nick, is important is that analytics and transparency, big data, everybody talks about it. It's an overused term, blah, 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 predictive analytics, right? Artificial, all that stuff. But
okay, we got all the buzzwords in. Hopefully, if they're listening in, we'll hashtag all of that, right?
I didn't say blockchain yet, so I
oh, okay, but we got it right there.
There we go. We got it in there. But the bottom line is the way we looked at analytics was how quickly can I assess a revenue cycle? So here I am sitting there with more than 50 clients in April of 2018, and I asked my team, I said, how do we know if we're doing right by the client and that client's doing right by us? And I got blank stares. So we developed what we call our revenue cycle scorecard, where it really reads like a story. It's something that we can access each month, and it brings a lot of we call them key performance indicators into a view that tells a narrative, and it tells me whether we're on target or we're not on target. And more importantly, if we're not on target, it tells me where to look. I can read these in 3 to 4 minutes a month and feel completely at ease. The market has really loved that concept because in this day and age, how many reports do these people try to look at to understand the health of the revenue cycle? I mean, hundreds of canned reports being printed out every month that aren't actionable. We're taking data, we're structuring it in a way that allow our users, i.e. us, obviously, and then our clients who use the service, to make informed business decisions. And that has been paramount for our team, and we see it in our clients.
Well, so focusing on that transparency so that we understand that, because I always love to hear that. One of the things that frustrates me is when we sort of have these, secretive discussions and people really don't know, don't understand. And I think that just breeds malcontent at best. When you talk about transparency, it's between you and your clients, you and the patients, you and where's this transparency and how does that work?
Yeah, well, it's really both parties. Now, as a service, as part of our service business, it's really us and the client. But what our clients are now using these analytics for is obviously holding the consumer accountable too. So I'll give you a prime example. I know that there are scheduled patients on the books to come in the month of November. Well, we've taken it a step further. Not only will I tell you, Nick, that you have 27 patients coming in November that already owe you balances from prior visits, but 7 out of those 21 people have already been written off to bad debt sometime in the last 2 years. Now you get to make decisions about how you interact with those folks, right? I would highly suggest you get on the phone before that next service and say, look, I want you to be a patient of ours. I want you to be a customer. We want to treat you, but we have to have some financial security as if we're going to move forward with the relationship. So again, it's taking different types of data together to tell a story, to create that transparency with you and the consumer, you and your revenue cycle, you and the insurance company, you and the provider, Right. And for us, you and your billing company. I always tell folks when they're trying to decide if they're going to go with us or not for revenue cycle services, I said, well, here's the scorecard. This is your report card every month that you're going to be completely holding me accountable to. So there's no way for me to hide performance anymore. And they love that. They're like, wow, you guys are an open book, And I said, but however, I'm going to hold you accountable as well. And that's really critical, because it's not just you guys holding the billing company. It's me turning around and making sure you're doing right. If you're getting your coding wrong, if you're not doing things on the front end, getting your coordination of benefits correct, getting authorizations in place, I'm not going to just tell you you're not doing it. I'm going to quantify it for you.
Right.
And so it is a mutual relationship there, and it's built around transparency.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Matt Seefeld. He's the Executive Vice President at Medevolve. We're just talking about the transparency elements of the requirement and the way in which Medevolve has delivered that. And one of the things that I think the analytics is doing or offering in this is that you're essentially prioritizing this work so that you get the best available utility from the resources that you have to work the accounts. Is that a fair sort of assessment?
That's right. Yeah. If you think that, I'll use the ARs as an example. If you look at open insurance balances on account receivable, depending on the size of the client, you're talking 20, 30, 40,000 claims. The average representative can probably manage, depending on the specialty, 750 to 1,000 at any given time. And we're mainly in the surgical specialties. So, your orthopedic surgery, your neurosurgery, and such, urology, ophthalmology, et cetera. How am I going to make sure that the 40 to 60 claims a day that my representatives are working are the right claims? They actually require intervention from a human to get it paid. That's part of the science, right? Because at the end of the day, if my folks are working things that are going to not yield a single dollar in benefit, well, guess what? I'm wasting my money and I'm not going to bring any additional value to that client, right?
Right.
And so that does become extremely important, making sure you're doing what's right. The second part of that is measuring outcome. I recently spoke at MGMA with one of our large clients, Academic Urology, their administrator up there, on this last Monday, down in New Orleans. And our whole discussion to this group was around AI, workflow automation, analytics. And one of the things that I hit home with this group, and I think it resonated, was we come from a world of measuring production. We're not very good at measuring outcomes. Now, the clinicians measure outcomes all the time. Why is the revenue cycle not measuring outcomes? Why isn't the revenue cycle saying that if Matt Seefeld worked an account, touched an account, did it or did it not create a positive financial outcome? Now, If it did create a positive financial outcome, what did he do to create that? And if it didn't, what did he not do? And so part of our AI, now our machine learning, is taking those positive attributes and then bringing those in as recommendations to the other collectors. The probability of a good outcome is much higher when you do these things on claims like this. Right. And this is where the science starts to come in. It's no different than what population health and management and all of these quality initiatives on the clinical side is. We're just taking it from the financial health side.
So I love the idea of that whole learning potential. But as I listen to that, part of me thinks, well, wait a second. If you're learning all of my tricks and techniques, do I start to become irrelevant in this process? Is the potential to sort of replace those individuals by some of that? Or is there so much work that they could work a bigger stack? So there's an opportunity to maybe offload the simple accounts that could be maybe automated from a collection standpoint. Is that where you see this going?
Yeah, absolutely. One is I don't think anybody in this day and age would say that the world is not becoming more automated. I use the joke at MGMA that my 5-year-old walked, we were at Panera the other day, and he walked up and ordered our entire meal on a touch screen, and we never talked to anybody. So, I mean, I travel for a living, right? I can't remember the last time I had to have an actual human conversation about my ticket. I mean, I make my changes on my iPhone, right? So yes, automation is here, and if people are not embracing it in healthcare, you're going to have a serious rude awakening here in the coming years. However, you touched on a good point. It's not necessarily about replacing as much as repurposing. Right. I tell folks that there's lots of areas to improve along the revenue cycle. So if you free up capacity in one area, you may well have areas for those folks to focus on. So prime example, if you free up AR reps, people who are working your account receivable, but you have major issues collecting patient debt up front, or denials such as authorization or pre-reg related denials, move those folks upstream of the revenue cycle. Move them upstream of the revenue cycle, right? So, but at the end of the day, you're going to have to reduce people, and you're going to have to do that through automation. And robotics is going to be a big key there. I remember when I started my consulting career with Stockamp and Associates way back in the day, and that was really the premier company that really Dale Stockamp was a genius. And that he realized he could go do these consulting engagements driven with analytics and workflow automation. And you know what? Our results were spectacular because we had ways to measure. He always said, measure to improve, right? If you can't measure it, you can't manage it, you can't improve off of it. And that stuck with me. 20 years later, I'm still following his methodology, and it works. But the bottom line is that even back then, we saw the ways in which you could align people, align their processes with the right technology, make sure you can measure outcomes, and you will have good results. But at the end of the day, back then there wasn't an 835. There wasn't, automation here, automation there. We were picking up the phone and calling insurance companies, staying on hold for 45 minutes and getting 3 status updates and then having to hang up and call them again. So we have a lot more automation today, and it's only going to improve. Measuring outcomes, though, the one takeaway today that I would say is that, all this automation is great. Analytics are great. If you don't have a way to measure in real time the outcomes, the financial outcomes that your people are getting for you with the actions that they do, right? The actions that you pay them a salary or hourly wage and benefits to deliver, you're not going to be relevant, in the coming years because there's too many uncertainties. What if we go to a single payer system? What if Bernie wins? Or what if we don't know? All right, we don't know what's going to happen with these reimbursement models. So if you have providers out there listening who are used to making a certain amount of money, the chances of making that same amount of money in the next 5 years is slim to none. And they don't have to do anything wrong to have that reduction. That's just the way life's going, And so what do? If you want to still be a doctor, which I hope you do, Hippocratic oath, you got to find ways to lean up. And a lot of it's going to be through automation. That's what Medevolve saw as an opportunity a couple of years ago. Obviously, it was driven by this revenue cycle redesign I had to do. And now we're selling this stuff to the market. I mean, my conversations when I go into an outside sales lead is not about a practice management system. I talk about AI workflow automation, analytics, outcome measurement. And then at the end, I kind of joke and say, by the way, you get a practice management system too. And that's really the reality that we're up against, and it's resonating with this market, and we're excited about where we're taking it.
Yeah, so I couldn't agree more. I mean, I'm often heard to quote Lord Kelvin, who said, if you cannot measure it, you cannot improve it. I actually think that's a misquote. I believe he wasn't the original author of that, but it's absolutely true. Data is the sort of essential element, and the more we have of it, the more opportunity. I'm going to push you a little bit on one of the hot buttons at the moment, and that's around surprise billing. If you've got all of this data and you're able to sort of predict from a bad debt standpoint, do you think there's any capacity to help in terms of supporting that, even if it's just a better guesstimate than, oh, I've got no idea how much this is going to cost? Do you think you're going to be in a position to help answer that with some of the technologies as you move up this stack?
Yeah. Well, first of all, I mean, patient estimators are now starting to become a pretty solid commodity in this industry. We actually did bring recently brought a patient estimator into our PM system, mainly so that people could actually go out and look at fee schedule, as well as look at historical reimbursement patterns based on those procedure codes and the payers. And give a good estimate that, hey, this is probably likely what you're going to owe, right? And so
and
it's one
split
thing
for the patient and the insurance in real terms.
That's right.
Oh, cool.
Yeah, because at the end of the day, I mean, you can
I'd
go
buy
out
that.
and figure out. Would you? Well, here's the thing, though. I mean, I knock myself. There's one thing to have the technology; it's another thing to actually leverage it and use it. And so. A lot of times I hear about clients will say, well, if it's not a perfect estimate, I can't use it. I will call that out all day long and say, what do you mean? I mean, if you can get 50% upfront of 50% of what you think it's going to be, do you know how much bad debt is written off every year?
Right. There's more than that.
Didn't pay at all. So I think transparency, there's two things. One, consumers are going to demand more transparency in how much things are going to cost. They're also going to demand quality. Not just the quality, the cost, how much they're going to cost, but the quality that they're going to get. You hear a lot of this stuff going around on these social robots that are going out there and looking at Google feedback and all these things on doctors. Those doctors aren't paying attention to what social media is saying. They need to now. Now, that's not something that we've gotten into, but we're looking at partnerships right now with companies who specialize in that area, because you realize when the consumer has choice, if I've got two doctors in a zip code, that both take my insurance, or both are orthopedic surgeons, and they're both equal cost estimate, but one's much higher quality and much better feedback online, who do you think I'm going to go with, right? And so
absolutely,
that's going to be important too.
Yeah, no, I keep telling physicians that. In fact, it's one of the most fun things I do in a presentation to a large group, typically at grand rounds, those kind of things. I say, how many of you have, paid any attention to this? And then I ask them, I say, well, Google your name and put the MD at the end, and you can see, because they'll come up, even if it's a relatively common name, it's pretty good. And you can see there's a proportion of the audience that go, oh my God! Because
right. I know. Wait, what are they saying? I mean, but it's the reality, right?
It is.
They have to start marketing their services, and and I think that we're going to continue to see a huge push on social. It's not really my forte. I joke with folks. I'm still trying to figure out Instagram and Twitter and what that means. I thought that was just something the president uses to communicate. But at the end of the day, I mean, they are building a brand. They also have to start thinking about how they can use big data analytics. I said it again, I get penalized for saying big data, but is starting to understand where their patients are coming from and what types of patients are entering their practice based on the payer mix. Right. One of the analytics we always look at is payer mix trending and really how that impacts liquidity, because if you need to start marketing to certain geographies, you need to know where to market. If you're going to spend money on billboards and mailers and things like that, right, understand the zip codes that bring you better paying patients, as well as better paying payers of those patients. And so that you can really start to run your business like a business, especially for these private practice. And that's who we sell to. We sell to the private practice specialists. We're not selling into the hospitals yet, although we're starting to look at how we can get more traction on the hospital side. But, these are private practice physicians. They want to stay independent. They don't necessarily want to sell to private equity just yet. And they don't want to get bought by the hospital just yet, So we're trying to give them the tools to stay independent. And that's one of our objectives.
Fantastic. Well, as usual, we've run out of time. We've talked a lot about people, process, technology, the willingness and capabilities that pour into this. The fact that, Medevolve essentially eats its own dog food. You created this and then essentially used it. You keep moving up the stack, which to me is the sort of the epitome of surviving and continuing to evolve. I guess that's Medevolve as a terminology. And I think some exciting innovations around this. I'm, just looking forward to seeing what's coming next. I think you're just really sort of at the bleeding edge of all of this. Fantastic insights. It just remains at this point for me to thank you for joining me, Matt. It's been a delightful conversation, and I appreciate it.
Dr. Nick, I appreciate the time too. Every chance I get to spread the word of what we're doing on automation and transparency and how it's impacting positively our clients. And we start to see an industry starting to move in this direction, which has been good to see. So we're excited about the future and what we're doing.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at Dr. Nick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com, and tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.